Good morning, everyone. It's 10 o'clock and I think we should get started. Welcome to the spring semester of a new year. It's an exciting time. I was telling my class yesterday that I have a slight preference for the spring semester because it feels like we're counting down to great warm Minnesota weather versus in the fall when we're counting down to perhaps not so great, or at least logistically more logistic barriers to teaching. So I'm always excited to start the spring semester. So welcome everyone. So today I'm actually going to be wearing two hats. And so I'll kind of I will toggle between the two and I'll let you know which hat I'm wearing. Right now I'm wearing that of the coordinator for the Epidemiology and Community Health Seminar Series. Good morning, my name is Ruby Nguyen. I'm an associate professor here in the division. So every third Friday of the month during our seminar series is something called an in-service. This has been something that Dr. Rosser had implemented a few years ago when he was coordinating seminars. And it was really a chance for us to get together and speak and potentially walk out with more hands-on skills and knowledge than some of our more theoretical and higher level discussions during other seminars. This happens to be the first seminar of the semester, but also happens to be an in-service date. So because of that, we actually ended up having 4 in-service dates, and yet we only had 3 committees in our division who generally take these in-service dates. So the 3 committees we have in our division are the Research Committee, the Education and Training Committee, and the Diversity, Equity, and Inclusion Committee. And they've all signed up, and they were very, very smart. Our colleagues are very, very smart, and they decided not to take the first in-service of the semester. So that left this one. But it actually has worked out very well because of the timeliness of this discussion today. So wearing my other hat, which is a new title for our school, and that is the Director of Undergraduate Studies, which is something that is present throughout the university campus. It's present whenever there is a bachelor's degree within a program. So it is equivalent to our DGS, so the Director of Graduate Studies in our respective programs throughout the school. So in that capacity, what I want to do today, and we are treating this as an in-service, is to give you a really broad introduction into our Bachelor's of Arts degree. And the reason I think it needs to be broad is because one, we have had overwhelmingly positive responses to our new degree program and the launch of it, or at least the announcements of it. And having said that, well, maybe a little too shy to tell me if they have negative, but because of that, there have been so many different discussions that are going on. Excuse me, perhaps in some respects, because of the pent-up demand. And I want to highlight some of those discussions as we move forward here. Discussions such as we've been hearing from community colleges speaking about how we can partner in order to more easily pathway a student from a community college into our 4-year degree at some point. We've heard from the Learning Abroad Center to see if we can incorporate some of their activities. We've heard from students in high school who are interested in matriculating into this junior admitting program. We've heard from instructors, faculty and instructors throughout the university, as well as outside of the university, asking if there's a place for them to teach in this program. So there has been, and there's also we had a very notable, we had a very notable request from Senator Smith, and I'll talk briefly about that, who we met last Friday. So there's been a lot of interest from a lot of different areas. So my really overly ambitious goal today is to talk about the program in totality like that. The other big mission I have for today is to answer the questions and to breed conversations with folks who haven't had the opportunity to do so. I think that we've had really good interaction with our School of Public Health leadership, University of Minnesota leadership, as well as the faculty in our school. But we haven't had as many opportunities to have discussions with the staff in the school or current students or even alumni. I'll be meeting with the alumni board on Monday. So I want to give this opportunity, thank you so much, Jeff, this place and time opportunity for you to ask questions and make comments as well on our program. So we do believe that we are a part of shaping future health of not only our local communities, but of course, globally. One quick note, again, this is going to be given from a school public health point of view, an internal school public health point of view. So folks, communications who've been fantastic to work with on this launch, communications says that whenever we see a triangle, as we see on the right-hand side of this figure here, slide here, we are to think about the undergraduate program. So we've been branded with these triangles. So when you see triangle, think it's something about the undergraduate program. Yes.
Ruby, can you clarify that? Isn't that the standard?
There are,
or are we not meant to use that unless we're doing the
there are
undergrad?
triangles throughout, and we'll probably give you other examples. Excuse me, there are blue triangles. Sorry, Simon, that's there are blue triangles. Blue triangles indicate undergraduate program.
Very helpful.
So I am up here by myself. However, on Zoom, I'm joined by Stephanie Wisniewski, the Director of Student Records, Curriculum, and Compliance, who has been working hand in hand with me over the last year in getting this program approved, and is working diligently on getting all the records and curriculum set up through the university system as well as our school public health system. And the reason I describe her is for two very important reasons. She has been invaluable, and then secondly, because all of these processes needed to be done. We needed to wait for someone like Stephanie to join our team, which was as of December last year, 2021. And she will be addressing as we move forward in this, not to the talk today, but addressing for us as the school public health community, these issues with the undergraduate program moving forward. So how many credits is it in the university system? How will advisors from across the university know about these programs? All of that falls under the capable hands of Stephanie. In addition, joining us today on Zoom is Dan Cheng, who you may know as a part of our graduate recruitment team. He has been stellar in working with us. He's the Associate Director of Recruitment and Admissions, and he's been stellar in organizing and implementing our first recruitment for our cohort this year. So the other unknown entity on this slide is a very important place, the place where students and faculty and students, current students can go to answer some of the most basic questions about this program. That's our website, as well as our email address. So whenever we have a question, whether it be from our graduate student services, which we've received questions from, or even our dean who is asking multiple questions about this program, we are sending everyone to this one website. And this website is multiple people answer this website. So it was nice to have one central location to have all questions asked, hopefully successfully answered, and then cataloged as we move forward. So all questions should go to that email address. So some of this might be reviewed to the faculty who we've been able to speak with across the school, but it'll be new to everyone else. And it is really a description of where we've been, why we needed to move from where we were, and all the successes that we've seen in undergraduate education thus far. So the School of Public Health has had a long history of undergraduate education. It's been specifically specifically with isolated courses up until 10 years ago when the public health undergraduate minor was developed. It was freestanding courses. And for those of you who've been around for a long time, and that includes me, we might remember Jim Rothenberger offering his courses as early as the late 1980s. But you know, Dean Emeritus John Finnegan speaks about how this school has offered undergraduate education in hygiene for up to 100 years, and that and that predates the establishment of the School of Public Health. It was, again, with Jim Rothenberger, who introduced the modern, what we were calling the modern day undergraduate public health courses at this university. And he taught them through our division, epidemiology and community health. He was housed in this division. And then early in the 2000s, additional undergraduate courses started to trickle in, but again, there was no program that knitted them together. Across the nation, roughly in about 2008, there was a movement to increase the number of undergraduate public health programs, but to do so in a very specific way. And that was not only to address future workforce needs, which we are all focused on as educators, but also to, in their terms, educate the citizenry about public health, to better inform everyone about what public health is. And so during those initiatives in the mid-2000s, the focus was on collaboration between liberal arts schools as well and public health institutions. So there were a lot of burgeoning either liberal arts only who had some public health expertise or combinations of undergraduate programs. We were a part of those early discussions. As you may remember, for those of you who have been on faculty for a while here at the School of Public Health, those discussions, even during that period of time, never moved away much from a minor. A major was not supported during those years of our School of Public Health. So during those years, while we knew that there was no support for a public health major, what we did instead was to try to address the mission of that national movement, which was to educate the citizenry about public health. And so a group of School of Public Health leaders, as well as College of Liberal Arts leaders, came together under, at the time, Dean Finnegan and Associate Dean Deb Olson, and collaborated, developed a novel and unique minor which was the first of its kind here at the University of Minnesota, that integrated a professional school with an undergraduate granting program. And therefore came the undergraduate public health minor. The undergraduate public health minor, their credits overwhelmingly are public health credits. There is a column of credits from which the students take approximately 2 courses from the College of Liberal Arts. And very recently, they told us the reason that they did that was to recoup for their expenses in running the program, because as you may know, that undergraduate public health minor was housed out of the College of, is housed out of the College of Liberal Arts. Now I'll get to the future of that minor later on. This has been hugely successful, the minor, not only the politics of it, but the collaboration between the faculty and the number of matriculates and graduates that we have had over the last 10 years. It is not uncommon for students to matriculate into a minor close to their graduation date. So in the undergraduate program, that's typically in the spring. So the number of matriculates in the undergraduate public health minor swells at the time of, around the time of spring graduation. And every year, over the last few years, there have been over 500 students in the spring semester who are matriculated in the public health minor, which makes it the second largest minor on this huge University of Minnesota campus. And that's quite an accomplishment for a minor that's only been around for 10 years. We are second only to Spanish language minor. And I think that's important to bring up, because not only the history of the Spanish language minor, how far along far ahead they are from us, but also because of the utility of the Spanish language minor. So oftentimes students will matriculate into the Spanish minor program in order to have that skill set. And so if we parallel that skill set, or the need for that skill set, into our public health minor, that students are interested in our public health minor because they want that skill set, regardless whatever career path they go into. That is one hopefully objective way that we can measure the success of our original objective for the public health minor, which was to educate the citizenry. So not only have we been successful in getting a number of students into public health through the minor, we've also been successful in many goals to increasing pathways into a career in public health. So what we're looking at here is matriculants into the public health minor, number of students. On the left and across the x-axis is the year. On the top line is the total number of undergraduate public health minor students who have been matriculated. And the dotted line, which is beneath it, is the number of racial minority students in the public health minor. And I want to show this data to you in a different way. By the way, thanks to our doctoral student, Isabel Ricky, for coming up with these. What we're looking at here, if we look at the right-hand most column, percentage minority undergraduate public health minor student, we see that in 2022, our last year of data, nearly half, by the way, that's gone up in the fall semester, nearly half of our undergraduate public health minor students come from a racial minority. Let me say that again. Nearly half of our minor students are coming from a racial minority group. So that makes us, and this is anecdotal, I yet to be able to provide you a reference for this, but the College of Liberal Arts says that that is the most racially diverse program that we have. So now let's move away from the public health minor and talk about across the nation, what is going on with undergraduate public health bachelor's degrees. And when I say undergraduate public health, these programs can have many different types of names. And for those of you on graduate admissions committees, you know this because you're seeing these as majors when they come in and apply to our graduate programs. They might be community health, they might be health and wellness at the population level, they might be health services and management. So in this analysis that JP Leiter did, this is not a part of the most recent paper, which I'm going to go over in detail, but he described the changing pattern of public health degrees. So here he looked at 4 different public health degrees: associate degrees, bachelor's degrees, master's degrees, and doctoral level degrees. So the topmost, or it's a little bit hard to see in black and white, but the topmost, the darkest line there are the master's degrees. So in 2020, there were 18,044 master's degrees granted. But the line under that, the line that eclipsed the master's degrees in 2020 is the number of undergraduate or bachelor's degrees granted in the nation. And then below that, the number of doctoral degrees in the year 2020 were just under 1,600 and just under 750 for the number of associate degrees granted in public health in 2020. So you can see in that one figure alone how rapidly bachelor's degrees have grown over time. So JP was interested in detailing more about the national trends in undergraduate education. And so JP, and I was fortunate enough to be a part of this writing group, but JP took some national data from several different sources to answer a few different questions. The first was not just the number of graduates with bachelor's degrees, but really where are they coming from? What types of programs and what types of schools are they coming from? So this figure is looking at 2 things. We're looking at the public health degrees awarded overall. So this is not unlike what we had seen in the previous graph. And then in the lower figure, we're looking at the degree awarding institutions. So remember I told you that there are freestanding programs without a graduate level degree program associated that are granting these public health degrees. In our Twin Cities area, that would include St. Thomas, Hamlin, and Hamlin. It used to include St. Catherine, but St. Kate's, but it no longer does because St. Kate's is now offering a graduate degree as well, as you know. So what we see with regards to these undergraduate degrees is the most common type of institution that's offering, well, in the year 2020, everyone is about the same. So it's about the same for the three different types of institutions offering. However, historically, it was a different story. So we can see the different lines. And again, it's a little bit hard to read in this black and white figure. But right now, currently, we are all on par, whether we are a graduate only program, a bachelor's degree only program, or both, which of course we at the University of Minnesota will be offering both. In this paper, we also looked at, and this is a series of figures that would be expected, but we looked at the accreditation status of the programs for bachelor's degrees, which is the first panel there, master's degrees and doctoral degrees. So overwhelmingly, if we know here B and C very well, the two last panels, we know that overwhelmingly our colleagues in other graduate programs are accredited. That wasn't the case early on in undergraduate education, but part of that reason, and now that's changed, the majority of undergraduate programs are accredited. But of course, the reason for that is in order to be eligible to be an accredited program, there needs to be some history and some time before accreditation happens. So panel A is very much expected, but what we like to see out of panel A is, as expected, over the course of the evolution of undergraduate degrees across the nation, we now see more accredited programs than non-accredited programs. One common question, and I'm glad this paper was able to start to answer this question. One common question is, where do the undergraduate graduates go after they finish their degree? And this is a distribution of those first places of work. So I'll give you a minute to walk through them. So unfortunately, we don't have much information on what the other category is for the for-profit organization, so 21% there. However, we do know a fair amount about the healthcare organization sector in which they're going. So 16% of them are going into some part of healthcare, a healthcare system. And while JP looked diligently for more detailed data on where these individuals were going, we didn't find it. What we can say anecdotally about our undergraduate public health minor students is when they go to the healthcare organizations, they primarily go to two places. They go to the research machinery of the healthcare organizations. For example, we know that our partners at Health Partners, Align, Blue Cross Blue Shield have their own research units at Mayo Clinic, and it is not uncommon for them to hire our new undergraduate minor graduates. And they also go into the healthcare organization's burgeoning portfolio in community health. So we know, for example, Blue Cross Blue Shield is a great example, and their partnership with our School of Public Health have an increasingly large portfolio in preventing disease and being in community.
Okay.
Yes.
I don't know if I'm going to show this afterwards, but it doesn't show here. I'm just wondering how many go into MPH programs.
Yes, we have that from another, and it's roughly, I believe, 30% directly, though, Diane. So this is not a good estimate of, and that's historic. So that is not a good estimate of lifetime MPH, gaining an MPH.
So 30% go immediately into.
Mm-hmm. Mm-hmm.
So,
but I have to say, can I asterisk all
Yeah.
this? This is the first body of data.
Mm-hmm.
So as these programs, and we're going to describe for example, workforce needs, immediate workforce needs. So some of these programs now are very much tailoring to get people into the workforce and not immediately into a graduate program to fill the needs in the workforce.
30% seems high, so those would be, they wouldn't be included in this. list.
Exactly. That's from a different paper. So one important question as people across the country think about undergraduate education is the debt level that undergraduates are graduating with, given how much they will be making when they enter the workforce, particularly when we speak about, when we speak about entry-level positions. So on the top, you'll see the median debt stratified by geographic area of the country. And on the bottom, you'll see the median earnings in their first year after graduation, again, stratified by geographic location. So the good news is they're making slightly more than they're coming out with in debt, but not a whole lot more. And we knew this, right? So we knew this, and we probably have a very similar graph for our graduate students when they graduate. And this is a similar type of analysis, but it's looking at the type of institution. There was a small number of private for-profits in this analysis, and then of course the private not-for-profits and the publics. And the students, of course, who attend the public schools do slightly better with the margin of difference between debt and earnings. Again, all this can be found in GP's recent paper. I think it was published last week in AJPH. So what really moved the needle for the School of Public Health in thinking about a major? Well, a lot of things. There was leadership. I can't see if John Finnegan is with us today, but John really made the decision that now was the time to move after careful consideration. And that was roughly in 2018, 2019, right before the pandemic. So, but what led to those types of decisions, what led to those conversations? And one of the ones that I'm going to highlight is the workforce needs. The number of the 80,000 people short that we expect to have. We are short 80,000 people in the public health workforce. And that number will only grow larger according to some of these statistics. So let's focus only on one sector of the public health workforce, local public health. And by local public health, I mean city and county level public health practitioners. So according to NACCHO, when they looked at the top executives in local public health, not only were they worried about attrition, which we're going to talk to in the other bullets, but they were also worried about meeting the needs of the community and meeting our goals to address successfully the needs of our community. And so when they looked at the top executives in the local public health agencies, only 6% were from racial minorities and 2% were Hispanic. So very clearly, just on race alone, there is underrepresentation in who is leading these public health agencies. And might I remind you that nearly 50% of our public health minor students are from a racial minority group. So one of our clear pathways is through undergraduate education into fitting this need, but then ultimately fitting our need to successfully address the healthcare concerns of our communities. Other statistics of the demographics of local public health, 26% were 60 years or older. An additional 30% were in their 50s. So clearly, really looking at this retirement cliff. While 40% of these top executives in large urban areas, that's an area servicing more than 500,000 individuals, 40% of those top executives in large urban areas hold public health degrees. However, when we look at the small local public health agencies, such as those servicing 50,000 people or less, only 23% of those folks hold a public health degree. The other leading degree that is represented in those local health departments is nursing. But this is probably the most staggering with regards to the workforce need and what entry-level jobs are available for bachelor's degree holding folks. 4%, and think about us here. Think about the metropolitan area, Hennepin County, Minneapolis Public Health, all of our local public health. 4% of our local public health here have a 4-year degree holder as their top executive, 4%, because we are so saturated with graduate level degree folks. But when we go out to those communities of 50,000 less throughout the state of Minnesota, for example, half of them are run by bachelor's degree holding folks or someone holding a 2-year degree. So very clearly there's not only need for individuals who have a bachelor's degree, but also leadership opportunities elsewhere and in great pockets of the state as well as in this country. So the picture was actually, this is a selfie, we were being funny. This picture was just taken on Friday. A week earlier, Senator Tina Smith, who's, for those of you who might be unfamiliar, on the right-hand side there. So Senator Tina Smith had contacted JP because she had heard, her office had heard about his large workforce grant that he received in the fall. And she had also heard about our new undergraduate major. She was one of the primary senators who passed the recent legislation in December to continue loan repayment programs for individuals going into local public health for exactly the reasons listed on these bullets. She's keenly aware of the shortages that we have, and she's looking for ways. The reason she came to visit and to listen was she's looking for ways to prepare a robust public health workforce, and she wanted to know how we were contributing to that. So she was keenly focused on local and public health because of her recent legislative successes. Oh, in the middle is Jake Dreyer, one of our current undergraduate public health students, who was so delighted to be there. This is one of the great reasons why we work with students, right? After the event, he leaned over and he said to one of the staffers, "I just feel destined to have come here." So it was wonderful to hear from Jake. Jake is actually a non-traditional student. He came to the University of Minnesota as a community college transfer. So I'm just going to quickly go over this timeline. The faculty have heard this timeline before. We at the School of Public Health have been talking about a major for eons and eons. I jokingly say that we've been talking about it since the Big Bang. Look, it took probably the success of evidence of the success of the public health minor to say that yes, we have the interest here, we have the curriculum, we have the fantastic instructors, some of whom are here today, and we have the support of the university. Boy, this couldn't have come in a more politically charged time at the university. It came during a time in which many, not just us, professional and graduate programs started to offer undergraduate courses and proposed undergraduate programs. And for those of you who luckily may not have delved into the political nature of universities yet, the concern is the undergraduate granting colleges felt like they were being squeezed out, that we were coming in and stealing the students. And so this was an incredibly politically charged time. And I'm so happy that we were able to show to everyone, the university and other colleges here at the university leadership and all of the other colleges, that we're in this to be collaborative. We are in this for a mission. We are not in this to steal students. So around 2018, 2019, Associate Dean Betsy Wattenberg, as well as Dean John Finnegan, had convened these SPH advisory committees that started to plan out moving forward with the major. Then, of course, the pandemic hit. So Betsy had the thought that maybe instead of large groups, we could be more effective if we move forward in a small group. And so she developed a small group of individuals, including myself, who designed and proposed the Bachelor of Arts degree. And when I say propose internally, as well as propose to the university, who has been very supportive of this program, I would say at least since 2017, maybe 2018. During 2021, we convened a great group of new and current instructors to develop our 5 new major core courses. And we're going to go over that briefly in a little bit. Now we're in 2023. EPC, our Education Policy Committee, has reviewed and critically discussed this program as well as our new courses and approved it to move forward early in 2022. And then, as you may know, we received University and Regents approval on December 15th of last year. So just about a month ago. These were the steps. I think I'm going to go through this very quickly, but I just want to reassure everyone that our curriculum has gone through many levels of approval, including that for the university. So there's a university committee called the Campus Curriculum Committee that is charged at looking at new programs, and they back in October formally approved a program. One thing I want to highlight here is, because we have received so many requests to teach in the program, both from current doctoral students to postdocs to, again, current faculty, as well as faculty from other institutions. I want to say, in order for us to have passed approval at the university level, we needed to show them that we currently have the staffing need. We needed to say, look, we have experience teaching undergraduates, we have fantastic faculty, we have the drive and the mission. And so for that reason, we're not currently looking for a lot of teaching support. That doesn't mean we won't be in the near future. It just means that I need to make sure that we had all the instructors in place before we even went to the university. That's why I'm not currently actively looking for folks right now. We have opened admissions. Admissions for this first cohort are open now, and we intend to enroll our first cohort into the bachelor's program this coming fall. We have set a February 15th deadline for the application. You'll see the word transfer. The reason we're calling this a transfer program is because it is a junior admitting program. We only have these students for 2 years or 4 semesters, which seems very familiar to you folks because that's how long we have our master's students. Students will be coming to us from within the university for year 1, this year, 2023, only University of Minnesota students, simply for the logistic reasons. After this year, we will be accepting applications from other institutions. And then, of course, we hope to be designing some pathways into our program from 2-year colleges. But this year only, it is only University of Minnesota students. And so repeatedly throughout this, the university term for a junior admitting program is transfer admissions. So by March, those who have applied will have been selected, and they will be notified. And then we'll have student orientation shortly after that. What are our aims for this program? We hope to, of course, prepare the next generation. I hope I've made at least a case for local public health, the need and the opportunities for undergraduate alumni to gain fruitful and fulfilling jobs in public health, maybe for the rest of their career, or at least until they come back and receive a graduate degree. We also aim to diversify the people working in public health. We aim to create pipelines into our graduate level education programs for all people, and hopefully to be able to diversify that as well. And then lastly, we aim to reach parity with our competitor schools of public health who have undergraduate programs. For those of you who are around in our last round of the dean search, each one of the candidates who the finalists had asked us about our undergraduate program. And of course, at the time, we did not have one. So I'm also on the search committee. We are very proud to be including in our description of our school now that we have an undergraduate program. So some of you have asked why a Bachelor's of Arts degree and not a Bachelor's of Science degree. By the way, because we've chosen a Bachelor's of Arts degree, it does not preclude us from offering a Bachelor's of Science degree at a different time. But it was decided to move forward with a Bachelor's of Arts degree because of the foci of our school and our expertise, as well as the mission. So some of the things that we focused on in determining a BA degree is our social justice focus, our need to address systems level changes, of course, prevention, population health. And you know this, the outcomes related to these programs is to provide foundational knowledge, working knowledge for an entry-level position, public health practitioner. We expect them to be able to use data and evidence. We expect them to support social justice prevention programs, and also to address challenges with social injustices. And we expect them to be expect them to be able to communicate professionally and to the community with their level of communication. So I'm actually really happy to report that this program will be a part of the university's writing enriched curriculum. And I decided to apply for this program for our BA because of a PhD faculty conversation that we had just a few months ago, which indicated that we at all levels should be working on educating our students about how to write to different audiences and how to be effective in our writing. So because we're joining this writing enriched curriculum program through the university, we hope to be able to say that our undergraduate instructors and our undergraduate students are coming to the graduate programs with at least, if not better, writing skills than what we've seen so far. Career preparation, I'm going to skip this because we've gone over this before. A lot of our students in the minors still aim to achieve a clinical degree, foreseeing themselves in public health, but being a dual degree holder. So we expect that to be the same with our major. And then also those who are interested in going on directly into public health. Some of you have been interested in the curriculum as a whole. There are prerequisites to this program. So we expect that perhaps our first cohort will be less than the 35 students anticipated, not because there isn't interest, but because of two reasons. One, we're only taking University of Minnesota students, and two, because they're just learning of the prerequisites. So the people who would be fully satisfying the prerequisites are going to be a smaller group of people than next year who will be preparing to address these prerequisites. And the way that we've addressed that is to be a little bit more lenient with regards to whether they've completed the prereq or they're in process of achieving the prereq. So here are our prereqs. Sociology, an introduction to public health, they must have completed that. A statistics course, those are listed here, and then either a general biology, anatomy, or physiology course. Those are our prerequisites. We will have, what was that?
C- or better.
That's the university standard for application, for being able to apply. General education requirements include these. And here are our main courses in our public health program. You'll see those listed as the 4 courses in the middle there. Those are our new core courses. Every public health major will be required to take those, and those courses will be restricted only to public health major students. They will also be required to take from our public health survey courses and topic focus electives, and those include all of the current 3,000 level School of Public Health courses. So if you currently are teaching one, or you know of these in your division, those will remain the same because the minor remains exactly the same. The minor will remain exactly the same. And this would be a good time for me to talk about the transition of the housing, the minor. The College of Liberal Arts, we, in good faith, have an agreement with the College of Liberal Arts that in approximately 2 years after we have our student services set up for undergraduate students, that we will house the minor. Currently, for the next 2 years and up to the next 2 years, we will be status quo and it will be housed in the College of Liberal Arts, at which time they, by the way, are more than happy to hand over the advising needs to us, but everyone wants to wait until we're up and running. Simon, did you have a question?
No, that's okay.
And then the other additional new course that we're adding is this public health capstone course, which will be which was developed and will be taught by GP Leiter, and it will be an interaction of what they learn in class as integrating it into community needs and assessments. The curriculum for this major will be between 56 and 62 credits. Again, this is a junior admitting program, so we only have them for these 2 years, 4 semesters. I wanted to highlight these community awareness courses. So students will be required, because we want to have a diverse public health workforce, students will be required to take 2 or more courses from this list, which, as you can see, include things such as Introduction to Social Justice, Social Change, writing proposals for grant management, but also literacy and American cultural diversity. So we want to make sure that our students are coming out with at least a working level of how our communities are diverse and the diverse needs of our communities. This was, by the way, this was a fight. This was a fight because it is not uncommon for the other Bachelors of Arts degrees across this university to require a language requirement, and we do not require it. Students may take a language requirement and substitute it for so a certain number of credits in this criteria, but we decided that we would not require it, and instead we thought it was more important to introduce them to these topics. And then here are our foundational courses, as some of you have seen already. These are the 4 that all majors will be required to take and are restricted only to major students. Here are survey courses. These are the courses that are currently available. They should look familiar to you. And here are topics courses, including Simon's 3011, which has been a fantastic contribution to our program. And these are electives and the capstone. And these are the number of credits necessary. So many of you, I'm going to end on this. Many of you have questions about how we're actually going to do this. Let's talk about the SPH infrastructure. We see these as 3 bins. There's an academic bin, and you are all familiar with this because it's the same structure as we have for the DGS, for example. So the DGS is actually, I think these bullets were taken from what we normally would expect of a DGS, but now for a DUGS, a Director of Undergraduate Studies. And then we have the academic support category, and then the student services category. Academic support includes things such as navigating university processes and academic student support. And student services support would include, for example, orientation, graduation, graduation ceremonies, career mentoring, and things like that. And you can see the key contacts for each one of the bins. This program is going to be offered out of our dean's office. So it is a centralized program. Each one of the individual courses, for example, Simon's course, will still be housed in its individual division, but all of these other support resources are going to be housed out of our dean's office. And this is just a flow chart of, for example, a very specific process for admissions and recruitment. You can see how Dan and Stephanie play critical roles in that, especially during this first year. We also have to rely on university expertise. For example, the transfer process for university students will be handled by the University Transfer Admissions Office. And then also we've been communicating very closely with SPH Communication so that we're all clear on everyone's roles and being able to communicate that to you all. Again, back to these 3 bins in our proposed undergraduate organization. You'll see here that the overwhelming majority of these folks are already employed here. So we're not suggesting to hire a big number of people. We are going to go and discuss quickly who we are going to hire immediately, but the shaded boxes indicate the people that need to be hired. Even I would say for my Doug support, future Doug support, I'm just going to be taking some effort for a support person elsewhere in the school. That's actually not a brand new person, but the other 3 are potentially brand new people. Someone will be hired to work in Stephanie's office. So for example, this would be the role of making sure that students are completing their necessary courses and requirements to graduate with our BA. And then someone will be hired as a student engagement coordinator as well, but those are later on. And this is the description for the career support person. So my apologies, I'm missing the advisor. So the very first person that's going to be hired is a undergraduate advisor. In fact, that job description, if it's not up already, it's going up in the next few days. Stephanie can probably tell us how soon it is going to be put up. Stephanie, can you unmute and tell us when that person's going up?
Yes, that should be up within the next week. I would say the others are anticipated in the future with no specific plans to hire in the immediate future. Those are just the things that we're thinking about potentially needing in the future.
Thank you.
The one that's been approved is the advisor.
Okay. So as I said, the applications for this coming fall are already open. Here are our basic requirements. So I will say to Diane's comments about C- or better, we expect this to be a very popular, this comes from the provost office as well. We expect this to be a very popular major as well as a very competitive program. We're only admitting a maximum of 35 students per year into the near future. I would say the next 2 years up until we get our process in place. Someone in biostats asked us a great question when we visited there, which was, okay, now we know that you're starting small, how big do you anticipate getting and how big will you allow us to get? And that will all depend on our ability to successfully achieve our goals and our staffing. If we are unable to handle the number of students, we simply can't take them. And keep in mind, we'll also have the minor continuing on. And of course, we know that will be huge. So to answer Diane's question, this will be a competitive program, but these are the criteria we have put in place for multiple reasons, Diane, for someone to be eligible to apply for our degree. This I've said already, we're taking U of M's enrolled students already. The deadline is February 15th. If you run into anyone who has questions about them, please do just send them to our website. And then if they have specific questions, they can ask via our email address. We will matriculate our first group, our first cohort this fall. So thanks, folks. I know that I covered a lot. Part of that reason is because I know that you have a lot of questions. So I think I saw a hand. Did I see a hand for a question back here? If not, okay. So I'm very happy to take questions in our remaining time. Simon.
3 thoughts. Number one, everything I love, which is incredible, and a huge thanks to you for spearheading this, Ruby. I'm so proud that I get to work with you.
I appreciate it.
First one is the student cap. If you've got 500 people doing a minor and only 35 slots for a major, I think we should anticipate some blowback from a lot of disappointed students who are trying to get in.
Yes.
And that may need some management. So I don't know how you're going to deal with that, but good luck. The second one is, I love And I'm so proud of the increase in racial diversity. But people thought about conversations, particularly on Morris campus, about increasing tribal access?
Absolutely. Thank you for asking. So we do anticipate working with our other University of Minnesota campuses. We absolutely do. And Morris is at the top of that list, partly because we have a lot of interest and some expertise from Morris. Having said that, we've recently, speaking of blowback, let me restart the statement. University of Minnesota Duluth has its own public health degree program. And the University of Rochester, University of Minnesota Rochester does as well. So we are willing to be collaborative, but we set out in order to work with other campuses, either within our University of Minnesota system. And again, as we're seeing through this outreach from community colleges to us, community colleges throughout the state as well. But yes, this will not only be a Twin Cities thing. Absolutely.
My final thought was the biggest impact I see on our graduate program is maybe all our graduate programs should consider making the undergrad degree equivalent to 1 year's experience out in the workforce. Because otherwise, we've got recommendations, at least in CHP, that are biased against the bachelors or going to suggest that they go out. And now that you've got a bachelor to master's pipeline, many students are not going to want to go out for a year. They're going to want to continue their education at the system or assume that they can.
I think that's one of the most important parts in continuing conversations between the undergraduate leadership and the graduate program leadership. Another is reducing the amount of overlap in coursework from the undergraduate to graduate level. We've already seen that concern from the students about overlap in coursework, not from our program, but from other programs. Students who are coming in from other programs with a bachelor's degree saying, can I test out of this, or I'm bored, or things like I'm not learning particularly anything new. And so we can do a better job in that now that we have the infrastructure and leadership to have those conversations. We'll begin now. Thank you, Simon. Any other questions? I think I see a question in the chat. Stephanie, do you want to say anything, or Dan, do you want to say anything about the blowback comments?
Sure, I'm happy to chime in. I think, as Ruby mentioned earlier, there's interest, and then there's interest in those who are academically qualified to apply right this moment. And so I've had lots of conversations with students who are excited to apply in the next cycle, and also with seniors who are on track to graduate this spring. Many of, as Ruby mentioned, many of the minors are kind of juniors and seniors. And so they some are weighing, whether they can fit in 1 year, the things that they have left, or are just expressing excitement that it's here and wishing that it was available to them 2 years earlier. And so the interest is coming broadly, but we are, working with the students to find the students that are both interested and academically eligible to start in the fall.
And so we have seen a little bit of blowback for different reasons. Like I don't have quite the number of prerequisites. What can we do? And disappointed students because of that. So we're getting real life training, on the job training of dealing with disappointed students. And it's unfortunate, absolutely. And we will be prepared moving forward. Vice Provost McMaster had said that he anticipates that this will be a large program. And so that's one of the things, many things that we have. So in the last couple of minutes here, I want to invite anyone who's interested in becoming more involved in the undergraduate program. So please do get a hold of me, or as I've been saying for an hour, to email that address. And the reason is, even if we don't have a position for you right now, that doesn't mean we're not going to in the very near future. So I would love to have those discussions. I will preempt that by saying, not really ready to talk about some of that until our admissions process a little bit down the road. So I'll probably schedule for around spring break time to meet with you, but I would really love to hear from you if you are interested in being involved in some way. Like I said, we have a contingent of PhD students here. It is not uncommon for me to hear from the trainees, both masters as well as PhD and some postdocs, to say that they would like more experience teaching or advising or mentoring at the undergraduate level, partly because they see career potential in that area. So please do feel free to reach out. Okay, I'm gonna switch hats quickly. Next week, we are having some colleagues come in from the Minnesota Department of Health to speak to us about a grand strategic plan that they have, and they would very much like to hear our input into that. So please do look out for the announcement, which will be sent out at noon today. Thank you, Katie, and I hope to see you, if not next week, in the coming weeks. Thanks, folks. Bye.